Okay, with this I would like to all welcome you to the session on the enabling environments for young people with disability in the context of HIV. I also would like to acknowledge the traditional owners of the land. I think some of you have been already in sessions around adolescents or young people and the discussions that adolescents in particular are also one of the populations that are left behind. And I think today we will hear a little bit more about those ones that are also having a disability. And we thought it would be an actual effect within the disability sector. I think it's a tradition to start with the voice of people with disabilities, and in this case with the voice of young people with disabilities. And I would like to invite you to just watch the 3-minute message, 4 minutes, okay, 4-minute message from a young person with a disability.
Imagine this. A young girl, a deaf girl, was raped. But no action was taken. Do you know why? Simply because this girl could not express herself. And simply because people around her could not understand her. Why? Because the girl is deaf. As a young girl doing advocacy, I decided to come up with something that could help this girl. Just using Facebook, I knew that I could do something that could help this girl. I started a Facebook page, and the Facebook page is called Deaf Women Forum Kenya. These people, especially other women with disability who joined, they could express themselves through this page. And I'm very happy to tell you that even other organizations saw this initiative and they joined me in this fight. What does this mean? It means that I have changed someone's life through something simple. You have the capacity to change this world. You have the right time to change this world. And that time is now.
We actually tried to get one of these young people here, and unfortunately that hasn't worked out. So we have got their message via the video. That's great. I have the honor to introduce you to Rosangela Bergman-Billing, sitting next to me. She is the Chief Executive Advisor for Disability of UNICEF, but she's also at the forefront of disability rights advocacy for almost 35 years. So we have a lot of experience here in the room. She's also the founder of the Inter-American Institute on Disability and Inclusive Development, and she works to promote the human rights and inclusiveness in Latin America in particular. And Rosangela will give us a little bit of an overview of the connection between adolescence, disability, and HIV.
Hello, good afternoon, everybody. Thank you, Jill, for the introduction. Thank you, everybody, for being here today. And it's good to start with Ashura, which is a 21-year-old girl from Kenya. And you could see that she's a girl of her generation. She's connected with social media. She's facing, as her peer girls, adolescents in Kenya, all issues that adolescents in general face, including sexual abuse that is very typical in the community of girls and women with disabilities as well. And why we are here talking about adolescents and why we are talking about adolescents with disabilities, because the adolescent population is identified as a population left behind in the response to HIV, and the disability population as well. So, why adolescents? Because adolescents are the only age group in which HIV-related deaths have increased. Globally, AIDS-related deaths overall fell by 30% between 2005 and 2012, but increased by 50% among adolescents aged 10 to 19 years old, during the same period of time. An AIDS-free generation in which all children are born free of HIV and remain so for the first 2 decades of life is within reach. An AIDS-free generation cannot be achieved without adolescents. UNICEF and UNAIDS are just starting pushing for the agenda on adolescence with an initiative called All In, a global initiative to end adolescent AIDS. The goal is to halve new infections and close the treatment gap for adolescents by 2020. How? They plan to do this. Increase investments in high-impact interventions that target adolescents most at risk to avert an estimated 2 million new infections among adolescents between now and 2020. All In means to bring all the different groups that now are invisible and excluded to the center of this initiative. And to achieve results for all youth, this initiative may reach out to and include adolescents with disabilities. Can you pass the next one too, please? Okay. So the new UNAIDS The Gap report that was just launched includes for the first time a chapter on persons with disabilities as an important population. It's chapter 11. And basically the whole evaluation of the MDGs on HIV will not reflect anything related to disabilities, but finally at the end we are saying that this is an invisible population that has to be taken into consideration in the next development agenda. So just moving a little bit to disability in numbers. More than 1 billion people, about 15% of the world's population, live with a disability today. In sub-Saharan Africa, the estimated proportion of people with disabilities is as high as 36% in Swaziland, 20 to 25% in Namibia and South Africa, 14 and 17% in Zimbabwe, Kenya, Zambia, Malawi, and the prevalence is expected to grow due to the aging of the population. Young people with disabilities are at similar or higher risk for HIV transmission. Why? They are just likely to be sexually active and use drugs and alcohol as their non-disabled peers. It was interesting today, we had a question from a journalist asking, but if people with disabilities don't have sex, how come they should be a population that would need a response on HIV? In reality, they are people first, they are adolescents first, they are girls, they are boys, and they have a condition that it's related to their functioning in society, but they have the same behavior and the same risks as everybody else. They may be at risk, a higher risk due to the lack of access to sex education, HIV prevention information and services, for sure. High rates of sexual and gender-based violence against children, adolescents, and youth with disabilities. Like we saw with the video of Ashura, if you are a person with a disability and you have someone, predator, thinking about attacking someone, a person with a disability would be vulnerable because if the girl is deaf, they think that she cannot communicate the situation to the police or the family. Same thing if the person is blind that cannot recognize you, or if you have an intellectual disability, nobody will trust what you are saying. So the vulnerability gets to 4 times higher than to the general population. Greater poverty in families where people with disability, families with persons with disabilities as family members, you have more people excluded from the job market, the costs of disabilities are higher, so these families tend to live in bigger poverty. Less access to education and protection as well. Extreme exposure to stigma, discrimination, and bullying. Imagine if you are a girl and you have the stigma due to gender, due to disability, and then due to HIV as well. high risk of social marginalization and exclusion, or all risk factors that can increase the exposure to HIV. Just using some voices of young people with disabilities that we collected through some focal groups done in Mozambique, in South Africa. Women with disabilities, for example, when asked about access to services and to education, would be saying that, I'm just forgetting the PowerPoint, so if you can just, next one, please. There we are. Thank you. There are radio and TV campaigns aimed to people living in rural areas, but they are not accessible if you're deaf. So they would need sign language interpreters or other ways of reaching out to populations that live with disabilities. Another woman said that I am HIV positive since 2008. HIV stigma is strong, but she considers that the disability-related stigma is even stronger. So you combine both, and that's what these people are facing right now. Adolescent girls and young women with disabilities, next one please, may be at increased risk of HIV infection due to their vulnerability to sexual abuse, lack of appropriate HIV prevention education, poor access to healthcare services, and widespread discrimination related to double burden or both gender and disabilities. In the context of access to services, next one please. Despite national policy and legal frameworks to support disability rights and scale up of HIV programs, implementation of policies is still very poor, and access to services for persons with disabilities basically does not exist. In order to eliminate new HIV infections among children, for example, countries need to address prevention care and treatment services for adolescent girls and young women with disabilities as well. Issues to be addressed. Next one, please. A large gap between, bless you, large gap between policy and legal frameworks and access to health HIV services for adolescents with disabilities is something that we have to find ways to address, and actually there are already many good practices, experiences that need to be brought into the systems and scale up. We need to integrate disability concerns into HIV-related laws, policies, and programs using inclusive approaches, multi-sectoral approaches. The continued vulnerability to adolescents with disabilities to sexual abuse and the inability to negotiate safer sex. This is something that we also have to work in the level of the community, training police as well, because the cases, when they are reported, they are not taken seriously. So this is another big cycle of invisibility also on reporting abuse in this area. Next one, please. Also challenges assessing basic HIV prevention information at health centers and national campaigns. The other day we had a story of youth in Mozambique that went for testing, and then when he went to get his result, he would be speaking only in sign language. He was deaf. And the health professional that was sharing the result with him gave him a thumbs up. Can you make a thumbs up there? This. And that's what he got as a result of his test, meaning that he does not know if this is positive or not. And I think this is a good example of what happens when you don't have access to communication and information. And of course, we can find many ways of getting this information right to this person, even if we don't have sign language in all the centers, but we can have a little piece of paper explaining very simply what you do if you're positive or not. So this is a typical example, what happens. People with disabilities are invisible to tracking mechanisms within the maternal child health system as well. So data collection, as we will see right now, next one please, is something that is extremely important if we're seriously about bringing all the groups left behind into the response right now. Generating data and evidence. There is limited information on the prevalence of HIV and access to HIV services for persons with disabilities in general, and little solid evidence based upon which to build policy and programming. Lack of high-quality population-based evidence to estimate the size of the population of young with disabilities at risk for HIV. It is time to define the epidemiology and risk factors for HIV in order to effectively advocate for results, for resources for those who are left behind. For the post-2015, data collection is extremely important. As I mentioned, the UNAIDS report right now. Next, please. We have to build this evidence, hopefully by 2016, we could already start getting some numbers around disability in a way that it can inform new policies for the next development agenda. We need to improve strategic information to monitor program inclusion and HIV service accessibility for adolescents with disabilities. We need to estimate the population size of adolescents with disabilities who are at risk for HIV and those who are HIV infected in high burden countries. We need to also disaggregate data by type of disability because the response needs specific adaptations, reasonable accommodations as we call, if you are blind, if you're deaf, if you have intellectual disabilities. Outreach strategy is extremely important because normally this population is in the margin of society and not assessing services or the system itself. So it's a challenge to collect data if you're not part of the system, and outreach strategies are very important. We have to work in community level to be able to identify households with persons with disability and take services there if they cannot access services normally offered in the community. So we have to invest in outreach and family-based approaches to make maternal and child health programs more inclusive. We have to ensure access to services, to facilities, and to information and communication campaigns. We have to use innovations to assess stigma and discrimination and include adolescents with disabilities in campaigns to combat stigma. We have to involve persons with disabilities as health agents and map capacities to increase the use of community resources and also introduce zero tolerance to discrimination in health services. We have reports from populations of people with disabilities in different countries saying that the biggest barrier they face is when they get into a health facility and the nurses would say, ask if they are not ashamed of being a woman with a disability who is pregnant and also HIV positive, meaning that the doors are closed to them and they are the last ones to receive treatment and attention. Next slide 2. This is an example of what we can do in terms of including persons with disabilities in our efforts, and many times it's just reflecting that the persons with disabilities are part of the general population, in this case of adolescents. This was produced in Mozambique. And when we are talking about the ones left behind, or campaigns that want to eliminate mother-to-child transmission, that want to bring all in, we need to include the adolescents, children, adolescents, and adults with disabilities in our efforts as well. Thank you so much.